My name is Frederick Welt. I am a cardiologist at the University of Utah and Associate Chief of the Cardiovascular Division. I come from a family of doctors, and so that probably more than anything directed me towards medicine. Although when I was in college, I actually was not pre-med. I actually got a degree in geology. In fact, we called ourselves pre-mud. But then I went to graduate school in geology and decided it wasn't for me, and so I redirected towards medicine. Everybody in my med school had to do a sort of a thesis, and so I got involved with a cardiologist doing physiology studies, and that just really grabbed me. So I knew from pretty early on in med school that I was headed towards cardiology. When you go into cardiology, there are a variety of ways that you can sort of differentiate yourself. From an early stage, I was interested more in sort of procedures and device implantation in the cath lab. And then it's actually been very interesting because during my career, things have really changed dramatically, what we're able to do, and especially in the world of valve disease. So that's been really interesting to live through, being able to replace valves now without open surgery. Ever since I got here to Utah, outreach, this whole notion and idea, I think, has sort of captured my attention. And just the idea of flipping things and bringing us out to the community, I think is just a really good thing for patients. Helping people, but not only helping people, but it's meeting them in their own environment. That I think is sort of the special thing about outreach. We live in a really unique part of the country. Here, people come to us from, 5 different states, and the distances are enormous. And I think location for people here is exceedingly important. Understanding their local environments, I think, helps you take care of patients. I think it inspires a lot of gratitude amongst the patients. And so what I would like to do, and sort of with this recognition, is just help others to understand how important it is, and that I still think this is primary to our mission as sort of, the major academic institution for, multiple states. And to champion that for others to sort of pick up the effort. Because I think it really is rewarding, and I think people, once they sort of get out there, will have the sort of same appreciation that I do for the advantages it brings to patients. I do feel a sense of pride, getting in a plane or taking a car and traveling, out to see patients. Not everyone wants to do that, and I think there's some sacrifice there, and I'm proud to do it.